Folic acid is a vitamin found naturally in foods such as dark green leafy vegetables, oranges, whole grain and yeast. Some bread, margarine and breakfast cereals have added folic acid. However, during pregnancy it is almost impossible to get enough folic acid from diet alone. You therefore need to take folic acid tablets if you are planning a pregnancy and for the first 12 weeks of pregnancy. If you did not take folic acid before getting pregnant, you should start taking it as soon as you find out you are pregnant. The reason for taking folic acid tablets in pregnancy is to reduce the risk of neural tube defects, such as spina bifida. In the very early stages of pregnancy, a tube is formed in your baby, and this develops into your baby's brain and spinal cord. If this tube does not close properly, the baby will have a neural tube defect. Spina bifida is the commonest neural tube defect. This can result in paralysis, bowel and bladder problems. Taking folic acid before pregnancy and for the first 12 weeks of pregnancy reduces the risk of this occurring. Folic acid may also reduce the risk of other birth defects, such as a cleft palate. In addition, folic acid is used by your body to produce red blood cells. For most women, the dose of folic acid is 400 micrograms daily. However, you will need a higher dose of folic acid, 5 milligrams daily, if you have a previous baby with a neural tube defect or you or your partner have a neural tube defect. You will also need a higher dose if you or your partner have a family history of neural tube defects or you are taking anti-epileptic medication. Women who have diabetes, who are obese or have bowel conditions like celiac disease or Crohn's disease also need a higher dose. Taking folic acid tablets before pregnancy and for the first 12 weeks of pregnancy is very important for you and your baby.